The war on drugs, quote unquote, has been basically a bust. If you take a look at the cannabinoids, they offer an entirely different approach and complementary approach to the process of pain management.
Hi, and welcome to the Awakening series. My name is Kimberly Archuleta. This is a series where we bring brilliant minds together. And today we have one of my favorite brilliant minds, Dr. Brian McAlary, Harvard-educated anesthesiologist, on the call. Today we're going to talk about pain management and CBD. Doc, thank you so much for your time today. I know you're a very busy man. I'm so excited about this topic. As you know, I'm quite passionate about CBD and, of course, pain management. But I'd love to hear more from you, the gentleman, the man, Dr. McAlary. Can you give us a little bit of background about yourself, and then we'll get into the meat?
Be delighted to, Kimberly. My background basically is not uniquely different from some anesthesiologists, other than the fact that I've been at it a little bit longer, a little over 4 decades now of clinical practice. I've had a diversified practice of both university-based and community-based. Currently, I'm involved in mostly ambulatory surgical patients and doing so in a context of locum tenens, which gives me incredible flexibility and gives me time to schedule things I really enjoy, such as our conversation today.
Excellent. Thank you so much. Can you give us some insight about your thoughts and or interaction with CBD in regards to pain management?
The 4 times in my practice when I have been actively involved in starting and developing pain management practices, it has become very apparent to me, as it is anybody else who has gone anywhere near pain management, even peripherally, that the scope of the problem of pain management is huge. If you look at random hospital admission data, at least 1 out of 5 admissions has, if not the key part of the reason for their admission, at least a central part to the patient of pain. The pain alone is costing our society over $560 billion in medical care and disability costs. So pain management continues to be a challenging and very expensive area. We know that we can treat pain with a variety of approaches, including the pharmacological ones, which we'll be emphasizing today, non-pharmacologic, including things like physical therapy, and if necessary, interventional ones like pain blocks and surgery. One of the concepts that's developed in my tenure of pain management and has made a very positive difference starting about 50 years ago is the concept of multimodal pain management. We've stopped asking one drug to do the entire work of controlling pain. That's unfair to the drug, and it's unfair to the patient, and it's unfair to us who are trying to get control. So if you look at the shortfalls, let's say you try to use narcotics. Well, wonderful drugs for things like musculoskeletal pain. Someone breaks their leg, has a kidney stone, narcotics are wonderful. If they have a problem like CRPS, narcotics are almost useless. That's asking a wrench to drive a nail. It's the wrong tool. Migraine, basically until the most recent breakthrough receptor drugs, migraine has been thwarting traditional medications. And the list goes on of things that don't work well. So then we have superimposed upon that side effects. I mean, let's say you take an NSAID, it can work great for an arthritic type pain, inflammatory pain, but it can also produce some pretty severe gastritis that can preclude its use. Other drugs, including the NSAIDs, can interfere with anticoagulant management. We also have, needless to say, in our society, a huge problem with substance use disorder. Substance use disorder has brought us to our knees as a society, and we're not really many far ahead of it than we were 15 years ago. The war on drugs, quote unquote, has been basically a bust. If you take a look at the cannabinoids, they offer an entirely different approach and complementary approach to the process of pain management. We all know that there's 2 endogenous receptors, the quote CB1 and CB2, and they can talk about them all they want, but we're still learning just how complex the upregulatory and downregulatory effect of these drugs are on the perception of pain. Now, admittedly, if we stray into the recreational use of cannabinoids, which have been legalized in some states, but not in most, we then get into psychotropic effects, which are really not ideal for the pain management who's taking these medications chronically, because they can have all kinds of problems, whether it's be impairment with driving motor vehicles, whether it's be attention deficit issues, short-term memory problems. So, if people take them intermittently recreationally, there's probably no real long-term harm. But if they're going to be given them on a daily basis as part of their pain management program, these side effects then become a real issue. Fortunately, with CBD, the diol and some of the other pharmacologically active components, which are yet to be fully understood, certainly medically not yet fully understood, but I think show great promise, at least in the anecdotal level. CBD has minimal to absent psychotropic properties. People don't have mood changes, they don't have cognitive changes, they don't get sedated, they just keep on trucking with no impairment in their ability to function on a day-to-day level. It also, we know that CBD provides negative modulation to the CB1 receptor, thus helping significantly with the severity of pain, and even involving serotonin receptors are influenced by this. Now, some people, sure, can have problems with diarrhea, and that can be dose dependent, or with time it lessens, but is easily managed. Or they can have problems with their cytochrome P450 system that influences and modifies, not in a desirable way, the metabolism of other drugs. But as long as these two things are looked for and monitored, they in themselves rarely prove a problem for prescribing in the pain patient picture. We know that 36 states have legalized the medicinal use of marijuana, California being one of the pathfinders back in 1996. But we still have significant problems, marked variability in access, the persistent irrational classification of any cannabinoid as a Schedule I agent. We see lack of universal acceptance even in the medical community, mostly because of lack of education within the medical community. Just recently, our medical students, including being exposed to this as part of their pharmacological training. And it's a politically charged topic. No doubt people come out with severe and extreme attitudes toward it, once again, typically based on lack of understanding and education. What do some of the valid studies show us that exist today, recognizing full well that we need many more quality studies? It tells us that there is reduction in pain, including even neuropathic pain, which has been, a bugaboo challenge in pain management. It has resulted in reduction of opioid use, either the elimination of opioids or the reduction in the frequency or dose. It has definitely enhanced the quality of sleep in people who have insomnia and sleep disruption associated with pain. And it has done so with no respiratory depression, which has been the single biggest bugaboo, both in the legal use and the abuse of narcotics. Its ability to influence visceral and cancer pain, not so great, at least CBD as we know it. Perhaps some of the other pharmacologically active components similar to CBD will be isolated and help. But right now, CBD doesn't shine in that arena. That's not where it works. Dosing is relatively simple. Typical patient, adult weighing 70 or more kilograms, you can start a 5 milligram dose of CBD twice a day. As you increase it, you screen for whether there's excessive sedation, diarrhea, and those things. Absent those, you can go up to a 40 milligram twice a day dose with a high safety profile. If pain relief is inadequate, then it is not unreasonable to consider that this is not a stand by itself drug. This is a drug that shines because of its complementary component in the multimodal picture. So we're not going to ask CBD to be the miracle cure-all, one pill fixes everything drug any more than we're going to do with the other drugs. But we're going to look at whether with the other medications, there is adequate response and pain control. And if not, we should not close our minds to the introduction of CBD into this multimodal picture. We've seen that combination result in multiple drugs being lessened and in the dose being lessened. Anecdotally, I want to share with you the experience that at least 50% of my education in the clinical application of these drugs has come from the patients themselves. These patients have come in with family members or friends or God knows what as a source, trying CBD in concert with their other pain management and reporting significant improvements. And then they encounter the legal barriers. Can they get prescription drugs? Do they have to go online and go out of state? Do they have to use the internet? What hoops and hurdles do they have to go through to get it, particularly in states where the physicians don't have prescriptive authority for this class of drugs? So what's happened is a lot of the use of these agents has come with a wink and a nod from the healthcare community. In other words, we don't tell the patients, yes, you should use it, nor do we tell the patient who is showing clear benefit that they should not use it. So we have to, those of us in the prescriptive side of things, have to walk a little bit of a balancing act in that regard. And hopefully as time progresses and as education and society advances, we won't have to be doing that silly dance. But currently that is part of the reality of the prescriber. I would also indicate that I would encourage patients who are considering or who are already using CBD to not do it in the form of an inhalational process, whether it be from raw plant extract or from vaping. The inhalational component carries with it concerns for bronchopulmonary health that make it a less desirable mode. It has a faster onset when administered in that form because the vascularity of the lung picks it up quicker. But the advance of edibles has made it possible to provide excellent control, precise dosing, and more precise control of quality. So edibles, I think, is indeed the way that the patient who is learning to incorporate CBD into their overall treatment should be encouraged to consider it. Also, if pain is very localized, let's say you have a monoarticular arthritis, you have a joint that is particularly bothersome, whether it be an SI joint or a thumb joint or whatever, it isn't necessarily in all those people to take it systemically. Some of the topical preparations that are available have proven very useful, just like topical NSAIDs, such as Voltaren cream using meloxicam as its active component, have proven helpful. For diffuse systemic arthritis or major arthritis, like of a hip or whatnot, probably topical is not going to be effective. It's not going to be able to get through the layers of skin or adipose to get there. But a very exposed bony area like an SI joint or a thumb, topical CBD should also be considered. In terms of availability and cost, we've seen the cost come down. We've seen the quality of the production, the harvesting, and the purification and availability of drugs improve dramatically. And I think this trend is clearly going to increase. Those who are actively involved in the farming and production of these compounds have done a great job. And hopefully, as part of one of the broadcasts, we'll be able to get someone like that on board to contribute their insights and advantage. Unfortunately, there is virtually no health insurance companies who will help with the cost. So the good news is not very expensive. The bad news is even if it's prescribed in those cities and states where prescription is possible, the health insurance companies have, for reasons that aren't clear, dug in and just not agreed to help pay for it.
Can I intervene a little, Doc? I love that you're talking about this because I've actually spoken to a friend who has a pretty big senior magazine publication in Florida, and he talks so much about how the seniors are paying so much for their pain pills because they're so expensive, or they've gotten to be so expensive, and so now they are, out of pocket paying for CBD products to help them manage pain, and it's still less than what they would pay with a prescription. So that just makes me so happy. I love that you brought that up. Thank you. Sorry to interrupt.
Yeah, no, it is a real issue because, the health insurance folk can hide, and validly, behind the fact that it's a Schedule 1 and therefore labeled as having no proven medical benefit. And therefore they have the perfect excuse endorsed by the federal government labeling to not pick up these costs. And even though the costs of most patients, even if they're on 20 or 30 milligrams a day equivalent of CBD, that's not going to bankrupt most folk, but it's still a cost that is unreasonable for the senior community to absorb when it is proven to be so valuable in that community. Those are some of my thoughts, and obviously both you and I will be available to anybody seeing this podcast. If they want to reach back out to you with some questions, we can get back to them and serve as a non-charge consulting services, because I think it's very important that we continue this effort to help people better understand pain management and particularly the role of CBDs. So those are some of my thoughts. Any thoughts on your part, Kimberly?
So thank you so much. I agree completely. Education is one of the most important aspects of CBD. I don't believe there's enough education out there for the younger folks, for people that, have pain, whether they're, senior and whatnot. So, you mentioned that some of the people that have come in with family members. Well, what if they didn't have family members to give them the insight about CBD? So I think, maybe even possibly creating a series like this and touching on certain topics in regards to CBD and pain management, or even the endocannabinoid system, I feel like it's just become more apparent that we have this, endocannabinoid system. And 10 years ago, people, doctors, chiropractors, whomever it is, people in the medical field, we're not learning about the endocannabinoid system. And it's interesting to me that people weren't. That's neither here nor there, but I would love to possibly talk on more topics in regards to having a botanist.
Yes.
Yeah. So having a botanist talk a little bit about the flower itself and kind of discussing, because I believe the top flower part is this where they extracted true CBD, right? The oil for the gummies, or the oil, whatever it is, for the isolate, the powder that people use for whatever it is that they use it for.
The seeds, for example, are not a common source for that. But, you touch on a very interesting thing, at least interesting to me. If you look at any drug that is beneficial, almost all, with very rare exception, have identified receptors within the human and most mammals. The cannabinoids are no exception. These receptors just didn't fall into place by accident. They were there to serve a very important role in the modulation and perception of pain. And if we can develop drugs with high efficacy and low side effects that can help those receptors do the job that they were put there to do, we're not giving a foreign drug to some person who has no ability to deal with it or receive it or metabolize it. We're basically taking advantage of what has been there for millions of years to improve on the basic structure that the body has been given.
Absolutely. I love that. Thank you so much. I'm glad we got to touch on the endocannabinoid system. It's so important for us to have a better understanding. A lot of us know about, our immune system and so on, but the endocannabinoid system, I hear, runs just as many things, right? I mean, the gut, the sleep,
it's a huge
mood,
influencer of many components of our body. Yes, it is.
Right. So, well, wonderful. Doc, this has been an amazing educational piece. I can't wait for the the greater good to hear this. And I truly appreciate your time. Like I said, I know you're super busy, but you're one of my most favorite human beings on this planet, and obviously one of the most brilliant. So thank you so much. And I definitely look forward to possibly doing another call in regards to CBD.
Look forward to it. You take care. Have a great day.
Thanks, Doc.